Hey everyone, Derpy here, and today I'm going to be doing a surgery game.
Including X-rays, impressions, and
I am
photographs.
currently working in school to do a surgery. Oh, hi. Okay. No! Stupid computer always opens up pop-ups. But I'm currently working to make the doctor career, so...
We put a special gel on the bite mold. The gel comes in lots of terrific flavors, like candy cane and chocolate cake. Can you put the mold in the mouth?
Sure. That must taste delicious, buddy.
Great job.
Sorry.
We'll have my assistant make the bottom impression. Once we have them both, we'll use the impressions to make a plaster model of the patient's teeth.
No, Spencer.
Okay, we've got our impressions and
No,
X-rays,
sir.
and we can see that our patient needs braces. I've also taken some photos for our before and after wall. We'll arrange an appointment for next week to put the braces in place.
1 week later. Sorry.
Our patient is back, and we're ready to put on her braces. In some cases, a patient may need spacers placed between the teeth for a week to create more room for the bands. Our patient does not. We'll start by polishing all the teeth. Making sure there's no debris on the teeth will ensure that the braces adhere better. Run the polisher over the teeth to clean them.
Well, I can just click continue. I freaked out.
Wow, what a marvelous job. I can almost see myself in those teeth. We need to put on some molar bands to anchor the braces. They circle a whole tooth and have a hook on the outside of the tooth. Slip the molar band over the tooth. We'll cement it into place later.
Yeah.
No smears. New Papermate Inkjoy gel pens.
Great. Now we can start putting the bonded brackets on the rest of the teeth. We've placed a lip guard over the teeth to give us room to work. Let's rinse off the teeth. Can you spray them with water? I'll run the suction to remove the water. Let's spray some air to get the teeth nice and dry. Can you handle that for me? With the teeth dry, we'll now put a small amount of bonding agent on the teeth. Wipe a little bonder on each one.
Oh, I did it. Done.
We let the bonder dry for a minute or two so that it is sticky. Then we place a bonded bracket onto it.
Done.
I will scrape off the excess bonding agent with a dental pick. Now use a curing light to harden the bonding agent under the brackets. Click to turn on the curing light.
You know what? I did it.
Great job! Now I'll put the bonded brackets on the rest of the teeth. There we are. While I was at it, I readjusted the molar bands and cemented them. We're ready to place the arch wires. The arch wire is a thin wire that connects all of the teeth by going through each bracket. Let's slip the wire into the brackets of the bands on the molars. Move the wire to the mouth to put it in place.
He's sitting alone. What am I going to talk about? I don't know. Use your imagination. Well, that should do it. Well, you boys were pretty chatty.
Good job. We do not want the wires to poke our patient, so now that they are all snapped into place, I'll reduce the ends by clipping them off with pliers. And there we are. The arch wire is in place. Now we'll use elastic ligatures to make sure the arch wire does not fall out of the band. The ligatures are little rubber bands we snap over the front of the bonded bracket using a different pair of dental pliers. Now you try. Place the ligature over the brackets indicated.
China? Yep, that's, yeah. China.
Continue.
And with the last ligature in place,
I'm
our
just way
patient
too
is done
lazy.
for today. In the next few days, she might experience some initial discomfort. She should plan on eating soft foods and taking over-the-counter pain relievers if needed. Orthodontic wax can also relieve discomfort. If there is a real problem, she can also...
Well, I tried to continue, but not responding. But anyway, I hope you guys like that. Fine, I'll let it go.
that it is infected with the virus and
It's
spine.
not.
He looks way too old. We gotta give him some goggles.
using a local anesthetic that numbs the carpal tunnel area of the hand and wrist. If a patient is nervous or uncomfortable, I'll sometimes use a sedative as well. A sedative is a drug given through an IV that places the patient in a dreamlike state. However, our patient will only receive the
I
local
hate
anesthetic.
those. I never
Go
had
ahead
them
and
with
get the operating area
Why?
numbered.
Oh my god. Oh my gosh, that noise. Oh.
With the wrist anesthetized, we can now begin the operation. I've already put a tourniquet around the patient's upper arm. Can you go ahead and outline where we'll be making our incision?
Well, no! No! That looks
Looks good to
nothing like I
me.
saw.
We'll be making a 3/4 inch incision at the intersection of those lines. Now take the scalpel and make the incision.
This is my life now. Oh.
Nice. I couldn't have done it better myself. Now we'll spread the incision wider to expose the transverse carpal ligament. This band of tissue is the cause of the problems. Place the retractors into the incision and spread it open. I think you're a natural at this. With the transverse carpal ligament exposed, I'll need you to slip a carpal tunnel guide into the incision. This is a blunt-tipped instrument with a groove on the upper surface to accommodate a special knife. The carpal tunnel guide is placed down the carpal tunnel ligament and is used to protect the underlying nerve and tendons. Go ahead and push the carpal tunnel guide into place. Once it's in position, you'll advance our special knife down the guide to split the carpal ligament.
Are you kidding
As you push the knife forward, you will feel it cutting through the carpal ligament.
Oh my god.
With the transverse carpal ligament cut, the median nerve is no longer inflamed. Now we can begin to clean and close the incision. Go ahead and irrigate the wound. When you're finished, I'll release the tourniquet, allowing blood to flow back into the hand. Great. Now you'll close the wound using non-absorbable sutures.
And where did you find that narrator?
I don't know. I found the voices on a Chinese prank show or soccer game or something.
With the wound closed, we'll inject additional numbing medicine around the operating site to help relieve some of the immediate pain the patient may feel after surgery.
Well, we're not in China.
I hear get the speed finger in. I do too. Why are they saying fever?
And lastly, we'll place a small dressing over the wound to absorb any residual blood.
This is pathetic.
Oh,
We'll immobilize the wrist with a splint and a sling, and after 1 to 3 hours, our patient is sent home to recover. Our patient needs to keep in mind that because of some...
No thanks.
No problem. Let's move on.
I kind of want to say this
In
one's
effort to make our patient as comfortable as
root
possible,
canal treatment.
we need to
This
inject
one might
local
not be.
anesthetic into their gum line. But first, apply a topical numbing gel to the injection site.
Okay.
This will help reduce any discomfort with the needle. Next, we can inject the local anesthetic. After the local anesthetic has taken effect, the area should become numb for a few hours. Use the syringe to inject the local anesthetic into the patient's gums.
What
Just
syringe?
below the tooth we'll be
What
performing a
syringe?
root canal treatment on. Let's give our patient a few minutes to relax, for their mouth to become
No, I feel comfy around syringe. And yeah, they put... Yeah.
Now that the patient's mouth is numb, we can move on to isolating the tooth. Since our patient's saliva contains contaminants that we don't want getting into the tooth, isolation is a critical step during root canal treatment. To isolate the tooth, we need to punch a small hole into the rubber dental dam and place it over the tooth.
Okay, here you go, buddy. Have plastic in your mouth.
Once the rubber dam is in place, put on a tooth clamp to keep it from moving. Next, we'll need to dry out the tooth as much as possible using our air water syringe.
Okay. Oh, this one doesn't seem too bad.
So far, so good. Now that the tooth has been isolated, we can create our access cavity in the tooth using our drill.
Wait. If I
The next step is to clean and shape the tooth's canal using a root canal file. Go ahead and give it a shot.
What? Jeez!
At this point, the dentist would measure the depth of the canal chloride, commonly known as bleach.
So you're gonna put bleach in someone's mouth. They say that. Here, that. Run it back. It finally works. I had to reset.
Where's Alvin?
Yeah.
Not up here.
Oh.
Patient's tooth for about 5 minutes to make sure that all the bacteria and tissue inside the tooth has been dissolved.
So you're putting. Oh. Aw, no music?
Great. Now use the suction to remove the bleach from the patient's tooth.
Good.
Get off of my car.
Next, we'll need to fill the tooth using a rubber compound known as gutta percha.
Gonna percha?
Gutta percha is often preformed as tiny, thin cones that we'll insert into the clean canal of the tooth. I've already added some sealant to the gutta percha.
So basically, a
Looking
pointy
good.
match.
A heated instrument is now used to remove the excess gutta percha. Pack the gutta percha into the tooth canal using a plugger.
Oh, please, Theodore. I can know. I went into Simon's lap, and then next thing I knew, bam, I got hit.
After the gutta percha has been placed, it is common that after a root
Okay, back.
canal, patients should expect some mild ibuprofen or naproxen
Anyway,
by
that's
brushing
it.
twice
Thanks
a day.
for watching. Shut up, Dr. Jeff. Anyway, thanks for watching, and I'll see you guys in the next video. If you want some more surgery games, please click that like button and subscribe if you really want to see this. And I'll see you in the next time. Peace out.